Greetings everyone, we're from PBL 18, and today we're going to tackle the case of Mr. H, an 81-year-old who is increasingly forgetful, unable to take care of himself, and fails to recognize his family members. He was diagnosed with type 2 diabetes mellitus, and his HbA1c and fasting blood glucose levels are rather high. Now, let's move on to the discussion.
In managing Mr. H diabetes, I will choose a DPP-4 inhibitors like sitagliptin. Given his advanced age and cognitive impairments, it can minimize the risk of hypoglycemia while still providing an effective glycemic control.
Although metformin is the first-line agent, but it is less ideal due to his condition that makes him at higher risk for side effects like GI problems and potential vitamin B12 deficiency. Also, it needs careful dose titrations and renal functions monitoring. In contrast, DPP-4 inhibitors offer a simpler regimen with a lower risk of hypoglycemia and side effects.
For Mr. H, strict glycemic control can help reduce the risk of microvascular complications such as nephropathy, neuropathy, and retinopathy. However, in elderly like Mr. H, microvascular complication and mortality cannot be helped with intensive control.
It may also have slow cognitive decline and improved memory, which is especially important for someone like Mr. H who is experiencing forgetfulness. However, we must be cautious about risk of blood sugar in older adults.
Okay, so one of the risks of strict glycemic control in elderly patients such as Mr. H is the risk of developing hypoglycemia. Why is that? It is because elderly patients are generally less sensitive towards the warning signs of hypoglycemia. This becomes more prevalent in Mr. H's case because he shows signs of memory weakness, thus make him more susceptible towards its complication.
A hypoglycemic state can lead to falls and loss of confidence in the elderly, worsening cognitive impairment, particularly in the case of Mr. H where it is recurrent. Overtreatment is also associated with dangers of medication side effects, including risks from polypharmacy.
An obvious concern that should be addressed is his increasing forgetfulness. Here's where asking about patient's social history is essential. Ask about family members or other people that could be his caregiver to ensure he is on top of his medication and all his hospital follow-ups. It's especially important in this difficult and delicate situation that he gets all the support he needs.
So common comorbidities associated with diabetes include heart diseases, stroke, kidney diseases, and also nerve damages. Over time can cause damage in the blood vessels and nerves, leading to complications such as neuropathy and also hypertension. Additionally, diabetes can also increase the risk of eye problems, including diabetic retinopathy.
In conclusion, Mr. H requires careful diabetes management to balance glycemic control with the risk of hypoglycemia. A DPP-4 inhibitor like sitagliptin is preferred over metformin due to its less side effects. Strict glycemic control may reduce microvascular complications but increases the risk of falling. Addressing his forgetfulness and ensuring caregiver support is crucial. That's all. Thank you.